My name is Ken Bing. I've been part of ACT UP since 1989. Um, I started going there because I've had some friends and roommates who had AIDS, and I had nothing to do with my anger about it. So I heard this is a good place to be angry and actually do stuff. So that's where I started in ACT UP, and kind of along the same time, I started my journey in working in healthcare. So I was in healthcare, and I was also an AIDS activist at the same time. And I learned a couple of things from being in ACT UP from that early on. First one was that um, it owed a large debt to the direct action ethos of the um, civil rights era, and also that there was, in the early queer liberation battles, it was all about being out in the streets, being loud and boisterous. So that was one thing I learned. The second thing I learned was that there was a lot of times where you really had to fight to get um, the larger group to acknowledge the intersectionality of different forces. There were a lot of different forces that kind of combined to make the AIDS crisis what it was. Um, Racism was definitely part of it. Um, Prejudice against other groups, such as in the early days, it was like Haitians were pinned as a high risk group, and they were like stigmatized against. So there was a lot of issues. And for the most part, we were able to address some of them. Uh, the group was predominantly cisgendered gay white males. So to kind of get your voice heard in that kind of atmosphere was sometimes a little bit difficult. Although they did have a lot of working groups and committees devoted to separate factions of the whole AIDS epidemic. We had a women's health caucus, we had a Latino caucus, we also had what we called the Majority Action Committee, which was somewhat ironic because we called it Majority Action because, especially in the earlier days, the majority of people who've been affected were African Americans. Um, and so there was a small group of us who actually kind of worked on issues to make sure that any trials or any research really included African Americans in the mix, because we didn't know whether at the time whether drugs worked differently in African Americans or how the access would be. The main goal of the group, especially in the early days, was effective drugs into bodies and just getting the drugs out and getting them to people. So that was the main point, prevent people from dying. Um, and later on, again, as things went on, people began to like realize that there was different vectors of how AIDS was treated. Um, and again, it had to do with race and gender, uh, immigration status. So gradually, the group tried to like acknowledge all of that and actually work on things. And I have to admit, sometimes it was easier to get that going than other times. Um, but, we just kept at it. And again, as the group grew, we started to get a little bit more diverse. It was still predominantly gay white men, but we started to get more voices heard. And also we tried to like expand the range of the different actions that we were doing. So in that way, I feel that we got a lot of things acknowledged and more things that could be done. Um, Most of the time, the actions that I was involved in had to do with access and needle exchange and other activities that had to do with making sure that we could get the access and the acknowledgement from the medical establishment and the legal establishment and also the government in general. Um, of course, also being in the health field, I know that race has a big part to play in the distribution of healthcare and the quality of healthcare. Um, and I see it every day. The people who have on lower on the socioeconomic scale, they have more limited resources in terms of what insurance they can get and what uh, doctors and specialists they have access to. And again, I can see sometimes it's gotten a little bit better, but overall, it's not been an equitable playing field. So I see that a lot. I see that a lot in terms of insurance and what it pays for and what it doesn't pay for in terms of treatment. And now, especially with COVID, um, again, once you have like a large health thing going on, you can see where things break down in terms of um, who is getting the newest and the best access to what's available. Um, and so again, you can see that for COVID, the majority of the cases, especially in New York City, is African Americans. Um, and again, it's because we have a lot of us have pre-existing conditions, which also has a lot to do with poverty, access to nutrition, crime, and also, all the stress of being in a lower income area, and also the stress of having the police constantly as a presence in the neighborhood, as more of an occupying force than actually people who are there to help and support the community. So there's a lot of factors that uh, go into why we are where we are today. What I'm liking about what's going on now is that, we finally have gotten to the point where people are saying, yes, not only is this a problem, but this is something we actually need to solve now. It's something that we need to address directly and not beat around the bush. We have to go to exactly where the issues are. In terms of the policing, in terms of economics, and in terms of just attitudes about race and racism in the first place. And I think as we're doing that, we're starting to get together more. And hopefully I feel that if we continue to actually see how much we need to work on and work on together, then that will improve other areas. Healthcare, which again, I'm still an HIV activist. I still want the end of AIDS. So hopefully they'll be part of the whole scheme of seeing where we can go in terms of healthcare, including how people are living and what we can do to make everyone's lives a little bit better. Well, in terms of the police brutality, whenever ACT UP had a larger demonstration, the police always targeted a few people to particularly rough up. And, we kind of had to not really make a joke of it, but try to make light of the situation because we would always, and I've been arrested a few times during actions. I've never been brutalized, but I've seen it happen to other members. I've seen people crammed into a police van. I've had the handcuffs put on way too tight. So we always had to like speak up and yell and rock the van around to get the officer's attention so that they can like loosen the cuffs. And frankly, we found ways of like positioning our hands so that the cuffs are never that tight. So if they did get to be a little bit tight, we could just wriggle out of them. So there was like some trade secrets on like how to handle being arrested. Also in terms of like how we're treated once we're put through the system also. And again, we always had our support waiting for us after we got out of jail. And that was definitely one of the better things about taking care of ourselves during any kind of action. Individually, I think talking to individual police officers was never particularly, we never communicate. We never were like shouting at each other. We would shout at them as a group, not in general, or not specifically. So it was never confrontational in that way. But once the police got in a group, once they were all in their lineup, it's a different situation. And what was funny at one point is, I had gotten arrested with a group of people, and we went down to the station. And what they had, I noticed, like at the sergeant's desk, there was a sign up for. This was before GoFundMe, but it was actually trying to raise money for this officer who had medical bills that he couldn't pay. And what I was being arrested for was standing in front of this insurance company because they had discriminatory policies for coverage. So, like, just for like kind of like the same reason that we were protesting, we had an officer who was affected by the high price of medications and all that kind of stuff, so they couldn't pay his medical bills. So that was interesting. But again, the way the police behave in demos, and especially as we've seen lately, is like pretty horrific. And I think in my neighborhood, it's actually a gentrified neighborhood, so actually I don't see that many police. Actually, in certain sections of my neighborhood, in the less gentrified part, you'd see a lot more police cars going by. Not so much patrol officers, but you see the cars going up and down the street. But in the more gentrified part, you would actually rarely see them. So you can just from there tell the difference between how the police presence or how they perceive where they need to be more. Again, where there's more white people on it, they don't really need to be there that much. And just from what I hear, on the more affluent neighborhoods with mostly white, you can like go like hours without seeing a police officer. But go a couple of blocks here on Myrtle Avenue and you'll see police vans all the time. I would say there is a difference now. There's always been levels of homophobia, queerphobia in all communities. So the Black community was no exception to that. And whenever ACT UP would try to go to like Harlem or predominantly African American neighborhood, there was some nerves. I'm not going to lie about that. There was some nerves, but I think once the message started to get out, like what we were doing there, people loosened up a little bit. Again, there are going to be some people who are, their fear and loathing are going to be at a level where you can't do anything about it. But what's different this time is just like the sheer number of people who are supporting us. And once, if the other group sees that there's this tremendous group that's actually attempting to join them and merge, there'll be conversations. And, I'm glad you mentioned that there was, conversation. I don't know how the conversation wound up, but at least that's a space where you can start having conversations. It's like, someone can just ask, why are all these people wearing white? Or, what's the deal with that? And it could be that they never thought that there might be some intersectionality in terms of what, we're going through with, the Black community in general, because there's definitely vectors that intersect. And I think that, that's actually a good thing. I mean, again, you're not going to get everybody. Some homophobes are going to be homophobes, and transphobic people are going to be transphobic. I think over time, again, it has to do with exposure. If you actually meet someone and have a chance to have a conversation with someone, that might put like a little crack, in your defenses. And we could wind up at some point really working together. So even if right now we're just marching side to side, maybe we can start marching in one group. It may not happen at once, but I think it's definitely starting to happen now. Well, I mean, the first thing I would say is now's the time, because I don't think there's going to be any better time to actually push for these issues than right now. I mean, sometimes I just feel like the timing is just right. I think the timing is just right. And I would also tell the younger queer kids that, there's a big history of protest, okay? And it's all been boiling up to this. There's been protests for civil rights, there's been protests for queer rights from way back. And like I said, you can ask your parents and your grandparents, they'll tell you. But now's the time to really make it work, because I think now's the time you have the most support. And besides, not giving up, because we can. Because at this point, we can't go back. We can't settle for half-assed police reform. We can't settle for having another Black History Month. I don't think 2 months is going to do it. We just have to just keep going. And if we have to step it up, step it up. I think there's enough people now that if we step it up and really stay on message, because there's a lot of people and media who will try to bring it to a different topic, bring it to a different place, talk about looting and rioting and that kind of stuff. Keep it on message, because that's what people are going to respond to, the message, not any side activities. So I say now's the time. That's my rallying cry. Now's the time. Again, there were more than a few African American and Latino AIDS activists that I was fortunate to meet and act up. Most of them are no longer with us. I would say the most fiery and influential to me, there was this guy, Ortiz Alderson, Keith Kylar, Robert Garcia, and there are a few others, but those three specifically I learned from them how to negotiate as a black man in ACT UP. I learned how to speak up a little bit more. I learned how to, um, when you're in the streets, how to actually um, get people riled up um, while keeping them safe while they were demonstrating. And they were just like great examples. Um, and um, and actually, what I'm glad is what ACT UP is doing this year is honoring the African Americans uh, who passed from HIV. Um, and again, and they're collecting names. I'm glad to give them some, and I think it's really good that they're going to do that, especially for this year.